Today is the official launch of the National Youth HIV Prevention Strategy and Campaign in the Vhembe District in Limpopo. The launch serves as the culmination of all Youth Month activities. The strategy will be driven through a robust communications campaign over a 3-year period from the year 2022 to 2025. It emphasizes the need for youth-led approaches in the development, coordination and operationalization of key youth interventions. SABC News reporter Katlego Nyoni is live from that story and joins us now. Katlego, a very good morning to you. Has the Deputy President arrived yet?
Good morning there, Desiree. We have just received information that the Deputy President, in his capacity as the SANEC Chairperson, will no longer be officiating this specific program. However, it will be led by the Deputy Minister for Health, Sibongiseni Dhlomo. He will then also be accompanied by other MECs in the provincial government. Now, of course, as you've mentioned, this campaign is targeted at preventing HIV predominantly amongst the younger demographic, that's also being adolescent males. So we are here today at Mdavula village where this specific campaign by SANEC is being launched. The Deputy President, in his capacity as the chairperson for SANEC, was meant to originally launch this specific program. However, it will be officiated by the Deputy Minister of Health. Now I'm going to speak to a community health worker here, as we know that this program is targeted towards preventative measures of HIV/AIDS amongst the population, mainly young people. I'm going to speak to a community health worker at Mdavula village who works at a local clinic here. Her name is Olga Makondo. Mayor Makondo, Menjani. Makondo, what problems do you as health workers at Mdavula village come across, and what help do you need from the government?
Okay, as a community health workers, tirana mindyangu hinkwayo leyi va ku yi ri kona kwala ka tiko ra hina ra ka Mdavula. Se hi nghena ndyangu wun'wana na wun'wana lowu va ku wu ri kona, a ku na mavabyi, mara ti-challenges leti hi hlanganaka na tona as a community health workers i ku emindyangwini a va hi amukeli, a va hi teki hi ri vanhu. Hi to ti-challenges ta ku hi hlanganaka na tona, se swa hi tikela ku va hi kha hi tirha ntirho wa hina, swa hi tikela ku fana na sweswi va hi nyike tifoni ku hi famba hi kha hi profile ndyangu wun'wana na wun'wana lowu va ku wu ri kona kwala tikweni ra ka hina, kambe vo tala va vona a va le ku swi twisiseni ku hi fika hi lava ti-ID numbers ta vona, ti-originals, hi tirha hi tona. Loko hi nga ri ha nyikiwangi swilo sweswo a hi koti ku tirha. Se ti-challenges tin'wana leti hi hlanganaka na tona, youth loko hi hlangana na yona nkarhi yin'wana hi yi dyondzisa yi ve kha yi nga hi tekeli nhlokweni. Se i ti-challenges letin'wana hi hlanganaka na tona, mara ha zama hi matimba ku la ku pfuna as a community health workers. A hi la ku ta ku va hi pfuna hi ri community ku vuhosi hinkwavo va hi tivisa ku hina hi tirha yini tani hi ri ti-community health workers.
Kensa Man Makondo, that's a health worker here at the Mdavula village, mentioning that some of the challenges they encounter are access to communities when they do their profiling work, attempting to get statistics within the community of mainly people that need access to proper healthcare services. Now, Desiree, right now I'm joined by an MEC here in the province. He has just switched department. She is now with the Department for Public Works, that is MEC Nkakareng Rakwale. A very good morning, MEC. Let's speak about the prevalence of HIV, not only in our province, but we know that South Africa has got one of the largest HIV programs in the world. 13.1 million people are on an antiretroviral medication, 8.2% of the population. You know, when we speak of preventative measures, especially within the youth who mostly possess risky behavior, you know, what steps and regulations is government putting in place?
Look, thank you so much. You'll remember that today's program is led by SANEC, but each and every province we have got provincial AIDS councils as well. We call it LPEC, and then we have got also district AIDS councils, wherein we do have the members. I mean, all mayors sitting there, chaired by the district managers. In a province is chaired by the premier, which also I think should indicate how we take, as government, take the issue of HIV/AIDS council. You see, if I was to use my experience, my past experiences as the MEC for social development, mostly cannot separate the issues of HIV/AIDS cancer and the substance abuse. Now, when they are intoxicated, they forget about protection, something which I think it should also be the message that should go along, because that also means the Department of Social Development, the Department of Education, in terms of educating the young people at schools, together with the Department of Health, should run a concurrent program wherein they continue to go to schools and make sure that they send this message, because the target should be young people. Because you'll remember, as a province in Limpopo, we shared a bigger chunk in terms of teenage pregnancy, but at least we can say a little bit of reduction on HIV/AIDS. So it's something that which, whatever that has happened to reduce the HIV/AIDS infection, can also be utilized to reduce the issue of teenage pregnancy. So I want to hope that young people today will be able to listen to the message, because they should definitely take care of themselves.
Thank you very much, MEC Nkakaren Rakwale. Desiree, as the MEC, therefore Public Works now, of course, speaking from her past experience as the MEC for Social Development, mentioned that you cannot separate the prevalence of HIV in communities without mentioning substance abuse. Perhaps, Desiree, it is also worth noting and mentioning that recently the Human Sciences Research Council in the province has launched the 6th chapter of the HIV prevalence incidence behavior and communication survey, also aimed at looking at risky behavior within the population, especially young people. Desiree?
Well, thank you so much for updating us on that event.